Tropical medicine tetanus. Tetanus. Definition. This is an acute infectious disease of the central nervous system caused by Clostridium tetani, and is characterized by spasms of the skeletal muscles frequently attacking the muscles of the jaw. Tetanus is commonly known as lockjaw. Cause. Tetanus is caused by the exotoxins of Clostridium tetani. Although the organism can live for a long time in any condition, especially dirty environments, so it can be found in dust, soil, or grass. Although the Clostridia can be normal organisms in the alimentary canal of animals, but when passed out and gain entry to human body, they become harmful. The organism can be found in cows, horse, sheep, or goat. Incidence. In babies born at home before arrival to the hospital. In homes where domestic animals are kept. Pathophysiology. The bacilli or spores usually gain access through deep punctured, cut wounds inflicted on the body where they multiply in anaerobic conditions. All dirty wounds are dangerous. When organisms enter the wound, they release two forms of exotoxins into surrounding tissues, tetanospasmin and tetanolysin. Tetanospasmin is a potent toxin that affects the CNS to produce the clinical manifestations. The toxins poison the motor nerve cells of the spinal cord and the brain, with the result that spasms occur in the muscles supplied by corresponding nerves. Route of entry. Infected ulcerated wound. Postoperative wounds. Umbilical stumps. Gunshot wounds. Septic abortion. Jiggers or foreign bodies. Burns and scalds. Signs and symptoms. Tropical medicine tetanus. The head is thrown back and the back is arched with great rigidity of the muscles of the neck, a condition known as opisthonos. Signs of inflammation, e.g. swelling of the cord, wet cord, offensive smell or pus, discharge from the cord, raised temperature and rapid pulse, loss of weight due to starvation, retention of urine or stool due to spasms of the sphincters. Sphincter may rupture in severe cases. Spasms of the muscles of the mouth and esophagus render swallowing difficult. Spasms of respiratory muscles cause long periods of anoxia and death may occur. There may be a wound or history of a wound. Management. The aim of management is to control spasms, destroy the organism and spreading toxins, prevent complications, provide nutrition, specific treatment. Penicillin is administered in all cases of tetanus to destroy the organism. Anti-tetanus serum is given. Sedation and muscle relaxants are administered, e.g. diazepam alternating with chlorpromazine. Excision of dead tissue focus of infection and irrigated with hydrogen peroxide, because the tetanus bacilli will not grow in the presence of oxygen. Wound is not sutured. Control of spasms. Absolute rest and isolation are very important. The patient should be nursed in a quiet room with dim light to prevent triggering of spasms. The door should be fitted with suitable closing material / spring to prevent slamming. The nurse should warm her / hands before touching the patient to avoid stimulating the child. Sedation and muscle relaxation, e.g. chlorpromazine Largoptil alternating with diazepam 6 hourly by nasogastric tube. Example 6 hourly regimen. 6 minutes nin 9 minutes 12 epam. 12 minutes 3 p.m. 3 minutes 6 pm. 6 minutes 9 epam. 9 minutes 12 im. 12 minutes 3 am. 3 minutes 6 am. 6 minutes nin im. Largoptil. Tropical medicine tetanus. Diazepam. General management. Maintain close observations and attention to a clear airway. Monitor temp. 2 or 4 hourly. Pulse and respirations may be done 4 hourly depending on severity and condition of the patient. Monitor spasms, noting strength, frequency, duration, and part involved. Use a spasm chart to record your findings. A mucus extract may be required for clearing the airway. Diet. Maintain adequate nutrition. A nasogastric tube is passed for feeds and drugs. Drugs are administered this way to avoid stimulating the spasms with injections. Prevent aspiration of fluids into the airway. Catheterize the patient. Maintain a fluid balance chart. Initially IV fluids may be required and later by NGT. Hygiene. Clean the cord daily with normal saline. Do oral care carefully. Turn the patient too early to prevent pressure sores. Prevent future tetanus from occurring by ensuring a full course of DPT. Use sterile equipment to prevent cross-infection. Care of the bowel and the bladder. Patient should be able to pass stool and urine. Give drugs as prescribed. Do physiotherapy for deep breathing exercises and active limb movements. Prevention. Health education of the public on dangers of using unsterilized equipment during delivering of babies. Dangers of using native medicine and other substances used or applied on the board. Immunization of all women of childbearing age. Ensure safe and clean practices during childbirth. Certain practices must be discouraged, e.g., application of cow dung on the coat of a child. Health education on cleaning wound thoroughly well with plenty of water and soap to prevent infection. Cover all wounds well with sterile dressing. Seek medical attention early for all cut wounds. Wear gumboots when digging. Complications. Fracture of bones or the spine due to spasms. Pneumonia due to heavy sedation. Tropical medicine tetanus.